What actually is knee arthritis and what can you do about it? In this video, I'll explain osteoarthritis of the knee, as well as what orthopedic surgeons typically offer you and why you might consider some newer treatment options. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, one of the things you need to know about osteoarthritis of the knee, and I'll use my handy knee model here, is that it's a breakdown of the bone and cartilage under your knee. The blue that you can see underneath the kneecap, or more commonly, the cartilage on the ends of the bones on the femur and the tibia. And once the cartilage starts to break down, you also get issues with the bone under the cartilage. And then what happens is, now, as your knee goes through a range of motion, those surfaces are no longer smooth and it leads to more damage. Now, there's been a lot of comparisons over the years among orthopedic surgeons that osteoarthritis is a wear and tear phenomenon. Basically, it's like the tread of a tire. The more the tread starts to thin, and again, there in theory is no way to rebuild that tread, but basically the tire goes bald and you have to replace the tire, i.e. a knee replacement. Now, that's a little misguided. There's more to it than that. It's very largely a result of inflammation. Inflammatory cytokines like interleukin-1 beta, interleukin-6, tumor necrosis factor alpha, they're just swirling in your knee for years and years after an injury or after repetitive stress, that those cytokines and degradative enzymes break down the bone and cartilage over a long period of time, and you have to stop that process. Typically, what orthopedic surgeons do when that cartilage and bone starts to break down is they'll say, hey, there's nothing we can do to rebuild the cartilage. We just have to treat your symptoms. And that's what leads to things like cortisone shots, or maybe hyaluronic acid injections like Synvisc or Supartz or Euflexa. Cortisone, as I've talked about in a number of other videos, yes, it can give you short-term pain relief, but it's not a benign treatment. It can do more damage. It can break down the cartilage even faster. And that's been shown in numerous studies that show people end up getting knee replacements faster if they have cortisone shots, especially the more of them you do. So I'm not a huge cortisone shot fan, except in the very rare circumstances. I just need a quick fix one time. Maybe I'm about to go on a vacation or something like that. I think I've done one cortisone injection in the last 2 years because I really do try to help people avoid that. We also know that a lot of times orthopedic surgeons will talk about going in and scoping the knee and cleaning it out, basically taking a shaver and smoothing out the worn out bone, the worn out cartilage, maybe trim out a tear of a degenerative meniscus, basically a meniscus that's starting to break down over time as well. But that surgery over the last 20 years has been shown repeatedly over and over in studies to, one, not offer any short-term relief, but also lead to more and quicker damage, quicker knee replacements down the road. So that's something we've really gotten away from. These cleanup surgeries, arthroscopic debridements for arthritis and degenerative meniscus tears, probably not something that's terribly helpful. And then obviously what the orthopedic surgeons typically will tell you is when that bone and cartilage damage gets bad, when it becomes bone on bone, when you're having so much pain you can't do what you want to do, you need to have a knee replacement. Now, knee replacements have done very well historically over time, in the sense that for a lot of people, millions of people over the years that had really no other options, it let them get back to at least some of what they want to do. Now, it's not necessarily getting you back to running long distances and a lot of different sports, but at least hopefully you could do your daily activities at least a little better than you were. Now, I have seen over years and years, especially with really active people, they're not satisfied with those activity restraints. And it's interesting. One of the things I don't hear orthopedic surgeons, especially joint replacement surgeons, say to patients very often is that surgery, knee replacement surgery, multiple studies, including one in the Lancet, one of the most respected journals in all of medicine, there's between a 20 and 30% dissatisfaction rate with the outcomes of knee replacement among patients that have had that surgery. They get a year out or more and they're not happy with where they want to be. So I'm a big believer in trying to avoid that surgery as much as possible, or at the very least, push it off as long as you possibly can into your 70s or later to minimize the chance that that knee replacement eventually wears out, and then you need a revision knee replacement. I think you should really, I personally believe you should really try to avoid that. As far as some of the newer treatments, the more contemporary treatments, and I've talked about these in a number of other videos. You can find them on my channel. Things like exosomes, things like penicillin polysulfate, things like different peptides like CJC 1295 or BPC 157. You'll see my full disclaimers in those videos about how they're either considered experimental by the FDA or you use them off label, and you need to know about all of that. And I'm not promoting these necessarily, just I get so many people that ask if these are out there. They're potentially an option. In the case of peptides, things like BPC, probably more of a pain relief. The penicillin polysulfate, and there's other medicines that potentially do this stopping the damage, things like metformin and rapamycin. Some people even speculate, and there's early studies, maybe semaglutide does it, but trying to stop the damage, stop those inflammatory cytokines and degradative enzymes that are chewing up the cartilage. Penicillin polysulfate is thought to do that very well. It's in phase 3 trials with the FDA for osteoarthritis right now. And then as far as regenerative treatments, trying to rebuild the damaged bone and cartilage, again, there's a number of different options, things like platelet-rich plasma. I mentioned exosomes. Everybody's heard of stem cells. For some people, those are potentially options as well. Again, I'm not necessarily promoting those because, yes, they are considered either experimental or you use them off-label. But for a lot of people trying to avoid a knee replacement, that's potentially an option. All right, I would love to hear your experience with your knee injury. Leave those in the comments below. Just understand I can't offer you medical advice, but I will try to answer your question in a future video. Make sure to subscribe to my channel to be notified when I release a new video. Click the bell to be notified, and you'll be notified when I start my next live stream, including my Ask Dr. Geier live shows. If you have knee, hip, shoulder, or other joint pain, and you want to get significantly better in the next 30 days without cortisone shots, physical therapy, or surgery, learn more about working with me in the description below this video. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.